Hi, my name is Lisa Cheek. I'm a pelvic floor physical therapist and certified lymphedema therapist at N2 Physical Therapy in Denver, Colorado. So one thing I hear quite a bit as a physical therapist from patients is that they don't know what normal should look like. And I think this is a big deal because in the realm of pelvic floor disorders, these aren't things that we typically talk about with our peers, with our family, with our friends. And particularly following treatment for cancer, when you're adjusting to a new normal, it's hard to know what's to be expected and what's considered abnormal. So there are certain conditions of the pelvic floor that are pretty common, but are still considered, that still would not be considered normal. So let's start with bladder function. So the number one myth that I would like to dispel about a healthy bladder is that it's never normal to leak urine when you don't mean to. And this is something that is really hard for many people to understand because we've been conditioned, especially women, and especially women who've had children have been conditioned throughout their lives to think, well, I've had children, I'm just going to pee a little when I sneeze. And that's just the normal that some people adjust to. Now, issues of urinary incontinence are very common. A large percentage of the population deals with these issues, and a larger percentage of the population who have been treated for pelvic cancers deal with issues of urinary incontinence. So I'm going to repeat that. It's never normal to leak urine when you don't mean to. Another common issue that I see as far as bladder health is that people get into very bad habits with their bladder and feel that it's appropriate to empty your bladder every 30 minutes, every 15 minutes. And, people get in that habit and think it to be normal. So normal bladder function, what it should look like is that the bladder should be filling at a steady rate. It should be able to fill up to a volume of 400 to 600 milliliters, which is quite a lot of fluid. Prior to fulfilling, about halfway, at around 200 milliliters, the brain's going to start to get signals that, hey, maybe it might be time to go try to empty your bladder. However, that is the first urge or the false urge. As the bladder continues to fill, that urge will go away. So the bladder can actually hold quite a bit of liquid prior to absolutely needing to empty. So at around 400 to 600 milliliters, that's when that really uncomfortable urge should kick in. We do get into habits of preemptively emptying the bladder at the same time every day, emptying the bladder when it's not really full. So this can lead to the bladder basically learning that it doesn't have to fill all the way before it starts to try to empty. And the more we feed into that, the more the bladder is going to basically think it is running the show. So, using good bladder habits and learning what is a real urge to empty your bladder and when is your bladder giving you that false urge can go a really long way as far as normal bladder function. Go ahead.